My mother called me. The sun was shining. It was warm and I was cold and I just laid down on the floor. And she goes, "How you doing?" And I said, "I don't think I'm doing very well." I think I kind of tried to power through for a while. I had 2 children that I was pretty much raising on my own. So I had to go to work, but I didn't want to. Sometimes halfway there, I'd just turn around. Even though I'd already driven 20 miles, I'd just turn around and go home. I started playing solitaire in bed during the day. My kids would come in, "Come on, we're hungry, we want to eat, we want to go." And I'd be, "In a minute, in a minute, in a minute." You know, I didn't know why I was doing that, but I just kept playing game after game after game after game. And I told my mother, I said, "I think I need to see a psychiatrist." And she said, "I think you're okay. Everything will be all right. You'll feel better. Just go. You'll have fun. Smile. Be nice." Called my doctor, made an appointment, went in, and he goes, "Yeah, you're depressed." And I thought, as if I didn't know there was a word to describe what I was feeling. It hurt. And so he prescribed me an SSRI. It didn't make me feel better. I would go from one to another to another. One would stop working, I'd take another one, I'd take a higher dose, it wouldn't work. Eventually, the doctor told me that it was treatment-resistant depression. You forget about the things that you enjoy. Forget that you enjoy gardening. You forget that you enjoy reading books. You forget that you enjoy decorating. I would go to the beach and stay there all day long because I didn't want to go home. One night, I sat down on the beach and just listened to the waves hit the rocks. That's just all I did. It was so lonely, and I just feel just depression. And I think I knew that I was not going to be okay and I needed to do something. It's probably when I went back to my doctor and said, "You gotta give me something that works." She goes, "Well, there's nothing else I can give you." I had heard about these Spravato clinical trials, and so I thought, no, I want to try that. I'm going to. So I called the doctor. He said, "Yes, it sounds very much like you might be a candidate for the trial." When I go for a treatment, I order a car and go to the doctor's office. He and I talk for a little while. How have I been doing? Am I sleeping well? And he takes my blood pressure. He gives me the first dose, and it's a nasal spray. You just spray it in one nostril, and then you spray it in the other while inhaling, so it goes into your nasal cavity. I do start to hear a loud noise that is happening in the building. It's not a loud noise that's happening in the building. There's a noise that's happening in the building, but it gets accentuated. After that happens and I'm sitting there with my eyes closed, I'm just seeing things swirling. Things are just moving together and around. It's white, it's yellow, it's red. It's not psychedelic. He checks my blood pressure again, and then I go home. The connection that I have with my psychiatrist has been it has been the most amazing relationship with a therapist I've ever had. Talking to him has made an incredible difference. I do take an oral antidepressant daily, along with Spravato treatments. The treatment, talking to the doctor, I think it's the whole package. Since I have begun the treatment with Spravato, I have remembered how much I like gardening and how much I like taking care of things in the house and rearranging the furniture. I think is one of the first things I did. It's amazing how creative you are and you feel it makes you feel good. The best part is that my mind is very clear. I got really into the idea of the greenhouse. It coincided exactly with the beginning of my treatment with Spravato. My father, he was an architect, so I called him pretty often and I'm like, so hey, I had this idea with my greenhouse. And he's like, well, send me your plans, send me your pictures. The last thing he said to me was, don't make it ugly. It's the best advice he could have given me. I really love using my hands. It's a lot of fun. It's the learning process and having done it yourself. You can go, wow, I just took that window out, fixed it, and put it back in. I've been doing a lot of catching up since I began to feel better. I do look back on my life and wish that I had not been held back by the bad decisions that are made while you're depressed and the lack of initiative that you have when you're depressed. When someone comes out of depression and stays out of it, it's amazing. Amazing.
Indication: Spravato, esketamine, Schedule III nasal spray is indicated in conjunction with an oral antidepressant, AD, for the treatment of treatment-resistant depression, TRD, in adults. Spravato is not approved as an anesthetic agent. The safety and effectiveness of Spravato as an anesthetic agent have not been established. Important safety information. Warning: sedation, dissociation, abuse and misuse, and suicidal thoughts and behaviors. See full prescribing information for complete boxed warning. Risk for sedation and dissociation after administration. Monitor patients for at least 2 hours after administration. Sections 5.1, 5.2. Potential for abuse and misuse. Consider the risks and benefits of using Spravato prior to use in patients at higher risk of abuse. Monitor for signs and symptoms of abuse and misuse. Section 5.3. Spravato is only available through a restricted program called the Spravato REMS. Section 5.4. Increased risk of suicidal thoughts and behaviors in pediatric and young adult patients taking antidepressants. Closely monitor all antidepressant-treated patients for clinical worsening and emergence of suicidal thoughts and behaviors. Spravato is not approved for use in pediatric patients. Section 5.5. Contraindications. Spravato is contraindicated in patients with aneurysmal vascular disease, including thoracic and abdominal aorta, intracranial and peripheral arterial vessels, or arteriovenous malformation, history of intracerebral hemorrhage, hypersensitivity to esketamine, ketamine, or any of the excipients. Warnings and precautions. Sedation. In clinical trials, 49% to 61% of Spravato-treated patients developed sedation, and 0.3% of Spravato-treated patients experienced loss of consciousness. Because of the possibility of delayed or prolonged sedation, patients must be monitored by a healthcare provider for at least 2 hours at each treatment session, followed by an assessment to determine when the patient is considered clinically stable and ready to leave the healthcare setting. Closely monitor for sedation with concomitant use of Spravato with CNS depressants. See Drug Interaction, Section 7.1. Spravato is available only through a restricted program under a REMS. Dissociation. The most common psychological effects of Spravato were dissociative or perceptual changes, including distortion of time, space, and illusions, derealization, and depersonalization. 61% to 75% of Spravato-treated patients developed dissociative or perceptual changes. Given its potential to induce dissociative effects, Carefully assess patients with psychosis before administering Spravato. Treatment should be initiated only if the benefit outweighs the risk. Because of the risks of dissociation, patients must be monitored by a healthcare provider for at least 2 hours at each treatment session, followed by an assessment to determine when the patient is considered clinically stable and ready to leave the healthcare setting. Spravato is available only through a restricted program under a REMS. Abuse and misuse. Spravato contains esketamine, a Schedule III controlled substance, C3, and may be subject to abuse and diversion. Assess each patient's risk for abuse or misuse prior to prescribing, and monitor all patients for the development of these behaviors or conditions, including drug-seeking behavior while on therapy. Individuals with a history of drug abuse or dependence are at greater risk. Therefore, use careful consideration prior to treatment of individuals with a history of substance use disorder and monitor for signs of abuse or dependence. Spravato is available only through a restricted program under a REMS. Spravato Risk Evaluation and Mitigation Strategy, REMS. Spravato is available only through a restricted program called the Spravato REMS because of the risks of serious adverse outcomes from sedation, dissociation, and abuse and misuse. Important requirements of the Spravato REMS include the following. Healthcare settings must be certified in the program and ensure that Spravato is only dispensed in healthcare settings and administered to patients who are enrolled in the program. Administered by patients under the direct observation of a healthcare provider, and that patients are monitored by a healthcare provider for at least 2 hours after administration of Spravato. Pharmacies must be certified in the REMS and must only dispense Spravato to healthcare settings that are certified in the program. Further information, including a list of certified pharmacies, is available at www.spravato-rems.com or 1-855-382-6022. Suicidal thoughts and behaviors in adolescents and young adults. In pooled analyses of placebo-controlled trials of antidepressant drugs, SSRIs, and other antidepressant classes that included adult and pediatric patients, the incidence of suicidal thoughts and behaviors in patients aged 24 years and younger was greater than in placebo-treated patients. Spravato is not approved in pediatric, less than 18 years of age, patients. There was considerable variation in risk of suicidal thoughts and behaviors among drugs, but there was an increased risk identified in young patients for most drugs studied. Monitor all antidepressant-treated patients for clinical worsening and emergence of suicidal thoughts and behaviors, especially during the initial few months of drug therapy and at times of dosage changes. Counsel family members or caregivers of patients to monitor for changes in behavior and to alert the healthcare provider. Consider changing the therapeutic regimen, including possibly discontinuing Spravato and/or the concomitant oral antidepressant in patients whose depression is persistently worse or who are experiencing emergent suicidal thoughts or behaviors. Increase in blood pressure. Spravato causes increases in systolic and/or diastolic blood pressure, BP, at all recommended dosages. Increases in blood pressure peak approximately 40 minutes after Spravato administration and last approximately 4 hours. Approximately 8% to 17% of Spravato-treated patients experienced an increase of more than 40 millimeters of mercury in systolic blood pressure and/or 25 millimeters of mercury in diastolic blood pressure in the first 1.5 hours after administration, at least once during the first 4 weeks of treatment. A substantial increase in blood pressure could occur after any dose administered, even if smaller blood pressure effects were observed with previous administrations. Spravato is contraindicated in patients for whom an increase in blood pressure or intracranial pressure poses a serious risk. For example, aneurysmal vascular disease, arteriovenous malformation, history of intracerebral hemorrhage. Before prescribing, patients with other cardiovascular and cerebrovascular conditions should be carefully assessed to determine whether the potential benefits of Spravato outweigh its risk. Assess blood pressure prior to administration of Spravato. In patients whose blood pressure is elevated prior to Spravato administration, as a general guide, greater than 140/90 millimeters of mercury A decision to delay Spravato therapy should be taken into account to balance the benefit and risk in individual patients. Blood pressure should be monitored for at least 2 hours after Spravato administration. Measure blood pressure around 40 minutes post-dose and subsequently as clinically warranted until values decline. If blood pressure remains high, promptly seek assistance from practitioners experienced in blood pressure management. Refer patients experiencing symptoms of a hypertensive crisis, for example, chest pain, shortness of breath, or hypertensive encephalopathy, for example, sudden severe headache, visual disturbances, seizures, diminished consciousness, or focal neurological deficits, immediately for emergency care. Closely monitor blood pressure with concomitant use of Spravato with psychostimulants or monoamine oxidase inhibitors, MAOIs. See Drug Interactions, Section 7.2, 7.3. In patients with history of hypertensive encephalopathy, more intensive monitoring, including more frequent blood pressure and symptom assessment, is warranted because these patients are at increased risk for developing encephalopathy with even small increases in blood pressure. Cognitive impairment. Short-term cognitive impairment. In a study in healthy volunteers, a single dose of Spravato caused cognitive performance decline 40 minutes post-dose. Spravato-treated subjects required a greater effort to complete the cognitive tests at 40 minutes post-dose. Cognitive performance and mental effort were comparable between Spravato and placebo at 2 hours post-dose. Sleepiness was comparable after 4 hours post-dose. Long-term cognitive impairment. Long-term cognitive and memory impairment have been reported with repeated ketamine misuse or abuse. No adverse effects of Spravato nasal spray on cognitive functioning were observed in a 1-year open-label safety study. However, the long-term cognitive effects of Spravato have not been evaluated beyond 1 year. Impaired ability to drive and operate machinery. Before Spravato administration, instruct patients not to engage in potentially hazardous activities requiring complete mental alertness and motor coordination, such as driving a motor vehicle or operating machinery, until the next day following a restful sleep. Patients will need to arrange transportation home following treatment with Spravato. Ulcerative or interstitial cystitis. Cases of ulcerative or interstitial cystitis have been reported in individuals with long-term off-label use or misuse abuse of ketamine. In clinical studies with Spravato nasal spray, there was a higher rate of lower urinary tract symptoms, polyuria, dysuria, micturition urgency, nocturia, and cystitis in Spravato-treated patients than in placebo-treated patients. No cases of esketamine-related interstitial cystitis were observed in any of the studies, which involved treatment for up to a year. Monitor for urinary tract and bladder symptoms during the course of treatment with Spravato, and refer to an appropriate healthcare provider as clinically warranted. Embryo-fetal toxicity. Spravato may cause fetal harm when administered to pregnant women. Advise pregnant women of the potential risk to an infant exposed to Spravato in utero. Advise women of reproductive potential to consider pregnancy planning and prevention. Drug interactions. CNS depressants, for example, benzodiazepines, opioids, alcohol. Concomitant use may increase sedation. Closely monitor for sedation with concomitant use of CNS depressants. Psychostimulants, for example, amphetamines, methylphenidate, modafinil, armodafinil. Concomitant use may increase blood pressure. Closely monitor blood pressure with concomitant use of psychostimulants. Monoamine oxidase inhibitors, MAOIs. Concomitant use may increase blood pressure. Closely monitor blood pressure with concomitant use of MAOIs. Use in specific populations. Pregnancy. Spravato is not recommended during pregnancy. Spravato may cause fetal harm when administered to pregnant women. Advise pregnant women of the potential risk to an infant exposed to Spravato in utero. There are risks to the mother associated with untreated depression in pregnancy. If a woman becomes pregnant while being treated with Spravato, treatment with Spravato should be discontinued, and the patient should be counseled about the potential risk to the fetus. Pregnancy Exposure Registry. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to antidepressants, including Spravato, during pregnancy. Healthcare providers are encouraged to register patients by contacting the National Pregnancy Registry for Antidepressants at 1-844-405-6185 or online at https://womensmentalhealth.org/clinical-and-research-programs/pregnancy registry/antidepressants/. Lactation. Spravato is present in human milk. Because of the potential for neurotoxicity, advise patients that breastfeeding is not recommended during treatment with Spravato. Females and males of reproductive potential. Spravato may cause embryo-fetal harm when administered to a pregnant woman. Consider pregnancy planning and prevention for females of reproductive potential during treatment with Spravato. Pediatric use. The safety and effectiveness of Spravato in pediatric patients have not been established. Geriatric use. Of the total number of patients in Phase 3 clinical studies exposed to Spravato, 12% were 65 years of age and older, and 2% were 75 years of age and older. No overall differences in the safety profile were observed between patients 65 years of age and older and patients younger than 65 years of age. The mean esketamine Cmax and AUC values were higher in elderly patients compared with younger adult patients. The treatment of TRD in geriatric patients was evaluated in a 4-week randomized double-blind study, comparing flexibly dosed intranasal Spravato plus a newly initiated oral antidepressant, compared to intranasal placebo plus a newly initiated oral antidepressant in patients greater than or equal to 65 years of age. At the end of 4 weeks, there was no statistically significant difference between groups on the primary efficacy endpoint of change from baseline to week 4 on the Montgomery-Åsberg Depression Rating Scale, MADRS. Hepatic impairment. Spravato-treated patients with moderate hepatic impairment may need to be monitored for adverse reactions for a longer period of time. Spravato has not been studied in patients with severe hepatic impairment, Child-Pugh Class C. Use in this population is not recommended. Drug abuse and dependence. Controlled substance. Spravato contains esketamine hydrochloride, the S enantiomer of ketamine and a Schedule III controlled substance under the Controlled Substances Act. Abuse. Individuals with a history of drug abuse or dependence may be at greater risk for abuse and misuse of Spravato. Abuse is the intentional, non-therapeutic use of a drug, even once, for its psychological or physiological effects. Misuse is the intentional use, for therapeutic purposes, of a drug by an individual in a way other than prescribed by a healthcare provider, or for whom it was not prescribed. Careful consideration is advised prior to use of individuals with a history of substance use disorder, including alcohol. Spravato may produce a variety of symptoms, including anxiety, dysphoria, disorientation, insomnia, flashback, hallucinations, and feelings of floating, detachment, and to be spaced out. Monitoring for signs of abuse and misuse is recommended. Adverse reactions. The most common adverse reactions with Spravato plus oral antidepressant, incidence greater than or equal to 5%, and at least twice that of placebo nasal spray plus oral antidepressant, were dissociation, dizziness, nausea, sedation, vertigo, hypoesthesia, anxiety, lethargy, blood pressure increased, vomiting, and feeling drunk. Please see full prescribing information, including boxed warnings and medication guide for Spravato, available at www.spravatohcp.com.